Dear colleagues, my name is Ivan Ževeljan and I will be presenting the topic Yoga in Pregnancy, Effects and Benefits. Before I start, I would like to thank the organizers on behalf of our whole research group for the opportunity to be able to present this topic and our research. In the beginning, I would like to discuss two very commonly used and well-researched complementary lifestyle intervention as yoga and various types of physical exercise. They are somewhat similar but also quite different. Yoga, being a psychophysical type of exercise, consists of physical postures, breathing techniques, concentration, and meditation. It starts with a prayer, followed by slow movements with breathing awareness and loosening exercise, asanas, bodily postures, pranayama, regulated breathing, concentrations, dharana, and meditation, dhyana, concluding with post-meditative relaxation with positive suggestion and ending prayer. On the other hand, physical exercise consists of warm-up, exercise, and relaxation. Major differences between the two is that the breathing is regulated, there is mindfulness during the whole time of the practice, and there is maintenance of postures during practicing yoga. Research data comparing the health effects of yoga and physical exercise concludes that yoga provides equal or superior health benefit in outcome. Let's talk about positive effects of yoga. Practicing yoga improves mental health. It mitigates age-related neurodegenerative disease, reverses memory loss, reduces anxiety, depression, and stress. It is a very useful anti-hypertensive lifestyle therapy. It reduces musculoskeletal pain. It improves metabolic syndrome, type 2 diabetes, and dyslipidemia. There is also a quality of life improvement, especially in chronic patients and in cancer patients. And there is a positive effect on immune function. That is mostly important as a possible complementary intervention for the population at risk or already suffering from diseases with an inflammatory component. So, we can conclude that yoga is a very useful complementary therapeutic lifestyle intervention. But, as yoga appears to be beneficial, mechanisms through this positive health effect is achieved is not well elucidated. Let's move to pregnancy now. We all know that woman's body and the state of mind are changing during pregnancy. There are profound changes in the cardiovascular system, there are changes in the renal function, respiratory system changes, there are metabolic changes, there are changes in the gastrointestinal system, immune system changes. But there are also changes in the brain, and they're structural and long-lasting. Therefore, wanting to achieve the optimal pregnancy outcome, one needs to adopt a holistic approach to pregnancy and pregnancy-related issues. So, we just hypothesized that a holistic approach is needed in order to achieve the optimal pregnancy outcome. And yoga, being a psychophysical type of exercise, seems like an optimal choice for a complementary lifestyle intervention in order to achieve that. But what does the data says? Does it really work? Well, the data shows that yoga in pregnancy improves maternal psychological health. It reduces pregnancy-related pain, reduces the rate of preterm birth, reduces the incidence of hypertensive disorders in pregnancy, and reduces the incidence of gestational diabetes. If we jump just a couple of slides back, we can see that all the positive effects of yoga outside of pregnancy are replicated in pregnancy. Discussing yoga in pregnancy, we are faced with the same challenges as trying to explain the positive effect of practicing yoga outside pregnancy, as little is known regarding the mechanisms through this positive health effect is mediated. Trying to fill that void and elucidate a possible mechanisms through which yoga can have positive health effect in pregnancy, we constructed and published a prospective cohort study in which we compared heart rate variability and cardiorespiratory synchronization as a proxy measures for autonomic central nervous system activity of 33 pregnant women practicing yoga and 36 pregnant women who engaged in 30 minutes of moderate intensity walking as a common form of aerobic exercise in pregnancy. When we analyzed our heart rate variability data, the analysis showed that all heart rate variability variables were statistically significantly different from the controls that were not practicing yoga. That difference was maintained through all 3 trimesters of the pregnancy. Our heart rate variability data showed that regular practice of yoga during pregnancy has a sustained effect on autonomic central nervous system. Compared to controls, regular practice of yoga decreases sympathetic to parasympathetic autonomic balance, and this effect is maintained throughout the pregnancy. In oversimplified manner, yoga seems to help those who practice it with better cardiovascular adaptation to pregnancy-related changes. When we analyze our blood pressure variables and phase synchronization variables, we were able to conclude that the systolic blood pressure was significantly reduced following yoga compared to controls, and that was true for all 3 trimesters of the pregnancy. When we analyzed the data of phase synchronization variables, we were able to notice a non-significant trend towards higher synchronization index between respiratory frequency and heart rate when we compared before and after yoga measurements, and with no such effects after moderate intensity walking. So, results on heart rate variability changes that are suggesting higher vagal activity following yoga is at least in part corroborated by the cardio-respiratory synchronization index analysis. So, to conclude my presentation, I think we can all agree that practicing yoga in pregnancy is safe, and the data shows it. There is also abundant of evidence that practicing yoga in pregnancy is related to many beneficial effects and pregnancy outcomes. The beneficial health effects of practicing yoga in pregnancy could be mediated through the effect of autonomic central nervous system, as we showed in our research. Positive effect of autonomic central nervous system can be maintained throughout the pregnancy if the practicing yoga is regular. Positive effect of practicing yoga in pregnancy may be the result of combined effect of physical activity and the altered mental state induced by practicing yoga, as we have shown. This is the main difference that separates yoga practice from any other physical activity. Thank you for your attention. Hvala, danke und namaste.